The earlier stomach cancer is picked up, the more chances there are of a successful outcome. If you have any signs or symptoms or concerns that you might have stomach cancer, you must seek early guidance from your doctor. They will refer you for specialist investigation, the most common of which is an endoscopy test. Endoscopy is also known as an esophagogastroduodenoscopy and is carried out by a specialist practitioner. I perform hundreds of these each year, but fortunately it's only a very small percentage that will actually have stomach cancer. There are two ways of doing this test. One is with a spray applied to the back of the throat, known as a local anaesthetic, the most common substance being lignocaine, that numbs the throat for approximately an hour. You'll be advised not to eat or drink for an hour after the procedure because of this. You may also be offered conscious sedation in the form of a benzodiazepine drug, the most common of which are diazepam and midazolam. These not only sedate, but they're also amnesic, so they may help you to forget about the procedure. If you have conscious sedation, you will need to have someone accompany you. The test itself only takes between 3 and 5 minutes. A mouth guard will be placed in your mouth so that you don't bite on the endoscope. The practitioner will have a nurse or experienced practitioner to look after you during the test. The endoscopist will pass the camera through over the back of the tongue and then down into the esophagus or gullet, into the stomach and then into the duodenum. If a tumour is found, biopsies or tissue samples will be sent for urgent analysis. You will also be tested for Helicobacter pylori by taking a tissue sample, commonly known as a CLO test, although sometimes some centres send them for laboratory analysis. Other tests may be performed, including a barium meal test. Barium is a chalky white dye that shows up on contrast X-ray and is normally swallowed and then coats the surface of the esophagus and stomach. If there are any irregularities to the lining, you'll then be referred on for an endoscopy test.